I find that what my practice does is it doesn't make me a better doctor. Maybe it does, but that's not the goal. The goal is to bring me, I often said, like, I never really understood this thing about, you're not supposed to be striving for anything. Well, of course, I want things, so I'm not going to pretend that I don't want things, but it's more about setting an intention rather than setting a goal. What I mean by that is, I know the kind of father I want to be, I know the kind of husband I want to be, I know the kind of person I want to be. And how do I know that? Because when I'm not being that, I feel it. I get mad at myself. Why did I say that? Why did I do that? So I do that maybe a million times, and finally you say, well, what am I going to do to not do that again? I can tell myself I'll never say that, I'll never get angry again, but of course I'm going to. So how am I going to deal with that? So this practice allows me to be more of the person that I want to be more often, not all the time. And then even when I'm not being the person that I want to be, to even see that too is part of life too, and that can even be okay, and not make it worse by getting down on myself and yelling at myself. So it's not unconditional positive regard, but it's also not just walking around saying how terrible I am and how I can be a better person, which is in its own way being egotistical, saying, oh, I should be better, and in its own way it's kind of a righteous egotism. But if just this is the way things are, and I set my intention to be other than that, or deal with it better, and that's how I think it leads me to be more of who I want to be in terms of my doctoring, my parenting, everything. It's not perfect, but it's an inch in that direction more to where I want to be, and that's enough, because nothing else has ever really had any lasting effect in that way. Well, to me it's about, as I said earlier, a little bit about dropping the resistance to the way things are, which is, you could say it, you can put it on a slide, you can read it, drop the resistance. It's just, if it's raining, accept that it's raining. Go, okay, yeah, but how do I do that? Because inside, it's not the way it feels. It feels like, God damn it, it's raining. It shouldn't rain. I know I shouldn't feel that way. So then you can be resistant to the way you're feeling about it. Another layer is, oh, I shouldn't be resisting this. Damn it, so you're resisting the resisting. The loops keep going on and on like that. So how do you begin to have some technique to see that for what it is and to do something with that, other than just tell yourself you shouldn't do that, which is another way of actually reinforcing the behavior. And that's where I find that specific practices that have been used for a couple of thousand years are helpful. What do you know is going to happen in your life? You know what's going to happen tomorrow. You have your plans for what's going to happen tomorrow. But are you going to die one day? You're going to die. Are you going to get sick? Probably. Maybe not for sure, but most people do before they die. Are you going to get older? Oh yeah, unless you don't, right? So if you're lucky, you're going to get old, sick, and die. If you're lucky. If you're not lucky, you're not going to get old and sick, you're just going to die. Right? And I'm not being facetious. I mean, really, if you really think about it, it's funny because, to put it in those terms, but really the fortunate ones are fortunate that they get to live to be old, therefore get sick, because aging means sickness in general, and then you die. So we all have to face that. Like, who doesn't have to face it? The patients that we're seeing are just facing it now. I'm going to have to face it sooner or later. So how do you live with the fact that you're going to die? Like, all this is temporary. Everything is temporary. People have said to me, "Oh, Stephen, you're being so cynical." I don't see how that's being cynical. I think it's funny because everything is temporary. It's not a belief. It's the way things are. I mean, you either understand it or you don't. It's not like I believe everything's, I guess if people believe in afterlife, that things that don't end, I guess they can say that maybe everything does go on forever. But for me, who doesn't, I'd say I don't believe in an afterlife, it's like, I don't know what happens after. I just know that nothing lasts in this life. Everything changes constantly, whether I acknowledge it or not. So I'm going to die. You're going to die. How are you going to deal with that? That's the essential question of life. It's how are you going to deal with that? Because the question that comes behind that question is, okay, I'm going to die one day. So then, how am I going to live? I could do anything. I could choose to interview people about what they're doing. I could choose to be a camera person and try and do that. But it's all going to end one day. So, like, this is it. Is this what I want to do? How am I going to live? It's sunny today. It's beautiful. There's only X number of days of beautiful before I die. If I could actually see, there's actually a finite number. There might be 1,000, whatever there is. That's what there is. So how am I going to use this? So the essential question that I'm not the only one to ask, been asked through the thousands of years, is how am I going to live? Knowing that I'm going to die. That's the essential question. think you live the answer. You don't actually answer it as like an answer.
Right.
You say, what has meaning, what has value for me now, and then what can I move towards that, continually move towards that, because it's a moving target. What has value now may change for later, some of those things. So how can I have a process where I move towards that more? It doesn't mean you're fully satisfied. You go, okay, now I know how to live. If you've looked at anybody who's written about this extensively, Montaigne wrote a lot about it, all the way back to the Romans. You don't come to an answer where you're at perfect peace. That's another myth. But the struggle itself is how will you engage in this thing called life, this messy, unsatisfying, often wonderful, ludicrous, awful, great, messy thing. How can I engage in a way where I won't say I have big regrets? Because that's the big thing is, you know, if you know you're going to die, you don't want to be that person on their deathbed who goes, oh, I should have done this, I should have done that. So how can you not do that? You try and learn from those who've been there. What did they say was important? What did they say what matters? And they said things that I'm hearing, things like, you want to do something important, do it now, don't wait. What's holding you back from doing it? What are your fears for doing it? Or, you know, how can you move more and more towards the person you want to be? Those kinds of things. So I think in my 50s, I'm more in a place where where more often I feel like I'm doing what I can, as unsatisfactory as that is, because you could always do more. I'm not there. I don't think it's even about being in a place where I know I'll never be there, and somehow being okay with that more often than not.